Hello, everyone. My name is Dr. Sandra Jan, and I'm a psychotherapist and an adjunct clinical affiliate at the School of Nursing at the University of Texas in Austin, Texas. I'm a proud member of the Psych Congress Steering Committee and the Psych Congress family. We hope that everyone is doing well during these uncertain and difficult times. I'm so glad that you've joined us for this 8-part video series addressing several mental health topics related to coping during COVID-19. Each of the 8 programs in this series is approved for 0.25 continuing education credit. The series is supported by an educational grant from Alkermes. We're in for a real treat today as we kick things off with Dr. Charles Raison, a dear friend and esteemed colleague. Chuck will be sharing his thoughts and experiences on concerns for patients with serious mental illness during the global pandemic. Throughout this video series, I'll have the privilege of speaking with other experts that will address these concerns as they relate to bipolar disorder, schizophrenia, opioid use disorder, alcohol use disorder, as well as digital solutions and telepsychiatry. I invite you to join me and our colleagues as we continue this important conversation. But before we get started, it's my absolute pleasure to introduce Dr. Charles Raison. Dr. Raison is the Mary Sue and Mike Shannon Chair for Healthy Minds, Children and Families, Professor, Human Development and Family Studies, School of Human Ecology, Professor, Department of Psychiatry, School of Medicine and Public Health at the University of Wisconsin-Madison in Madison, Wisconsin. And Chuck is this year's co-chair for the Psych Congress National Meeting. He's also an esteemed and beloved member of the Psych Congress Steering Committee. Chuck, this is a broad and vast topic that we're going to be discussing today. I wonder if you'd begin by providing us with an overview of the problem.
Yeah, well, the problem is that mental health is always difficult, and if you look at trends, especially in the United States over the last couple of decades, it's pretty clear that a number of mental disorders, especially depression, and things related to it like suicide have not been dropping. In fact, they've been increasing. So the modern world, at least our version of the modern world, seems to be doing something that is antithetical in many ways to good mental health. And then on top of that, all of a sudden you get this once in a century, once in our lifetimes stressor that's not just a personal stressor, it's a massive societal, global stressor. And, I think one of the great challenges of the COVID pandemic is that it presents us with this horrible double blind, both as individuals and as a culture. The double blind is, we have an evolved fear of infection. We have a fear of death. So we're very driven to protect ourselves. In this case, it means isolating from other people. On the other hand, we have an equally strongly evolved, desperate need as a species to be with each other, to be in proximity with each other. I mean, COVID has shown that our entire world is interdependent and dependent on each other. And the drive to stay safe from the infection collides directly with the drive to be with other people. And of course, unfortunately, our financial world is also built on that drive to be with other people. So we're constantly faced with this choice. Do I want to stay safe from the infection and suffer terrible financial and personal consequences? Or do I want to take the risk and try to reestablish my finances and personal connections, but undergoing an increased risk of COVID? And that makes the brain, the heart, and the mind just crazy. And so it's probably not a surprise, although it's very distressing, that there are estimates that deaths by despair, meaning deaths from things like suicide or substance abuse, are expected to skyrocket. In fact, there's expected to be about 150,000 deaths from despair that would not have occurred had the pandemic not happened. So it's a really significant problem, and it's hitting all of us at all levels. So, certainly before we talk about patients, I should probably say that, mental health clinicians, us, you, me, we're also human beings. And this is putting a tremendous stress on us. It's putting a stress on how we do our work. It puts a stress on us as we worry about our patients. We worry about our families. If we're going into medical settings, we worry that we might be increasing the risk that our families or ourselves will contract COVID. Um, and then, of course, folks with really serious mental illness, things like schizophrenia and bipolar disorder, very severe OCD or autism, um, very, very severe major depression, um, are at heightened risk already. Already, when you have those types of disorders, the stresses of the world are an extreme challenge. And so COVID is especially worrisome for our patients. And and there's a number of reasons why they're going to struggle. There's access issues. They're getting better, but the whole world stopped and people were disconnected from their clinicians. I've already said this, but there's financial stressors, and often people with serious mental illness are already facing financial stressors. There's a risk of diminished adherence if you can't come in and see your providers, or if things otherwise get turned topsy-turvy in your life. That can make adherence to medication regimens or psychotherapeutic regimens more difficult. And then also, folks with mental illnesses have higher rates of obesity, hypertension, diabetes. And one of the surprises about COVID is that, it was initially thought to be a lung disease, and that turns out not to be exactly true. It certainly hits people in the lungs, and that's often what kills people, but it really looks like it's a vascular disease, that it interferes with the inflammatory tone of the vasculature in ways that cause lung problems, but also heart problems and kidney problems. So the connection between mental illness and impaired vascular function as a result of things like diabetes and obesity really highlights this additional concern for folks with mental illness.
I'm sitting and thinking about your answer, Chuck, and it is an excellent overview of the problem that we are facing, not only for our patients, but also for us. And I think that is an extremely important point. So thank you again for the overview.
Sure.
As I think about all of our colleagues, Chuck, all of our Psych Congress family members, all of our professional work, it's taken a hit from this pandemic. And I'm wondering, what are you seeing? What are you experiencing?
Yeah, well, so let me maybe talk a little bit about practice in general, and then I'll give you an example of something that's different in the practice I do. So, what I teach in the medical school, and I supervise residents at the University of Wisconsin-Madison. And so some of the things I tell them as we all struggle with how to provide optimal care, especially on inpatient settings, or I often will supervise on the consult service where we go see medically ill patients, where seeing patients in person becomes a real challenge in these sort of very difficult situations. One of the things I try to remind them is, there's an old axiom: don't fix what is not broken. And so it's really important that we do everything we can to help our patients who are on stable medicine regimens and doing well on those regimens to stay on them, because there are data now over many years that suddenly stopping medications is a big risk factor, not just for withdrawal effects with things like antidepressants, but also a significant increased risk of having a relapse of the underlying illness. So really important to help people think through and try to make as easy as possible for our patients that are doing well to stay doing well by staying on their medicine. I think the other thing that we have been talking a great deal about is the importance of non-pharmacologic interventions, things that things that are not a pill, but that we know have potent benefits for mental wellness. And these include things like exercise, sleeping well, staying socially connected, even in an age of physical distancing. There's just a number of these things, eating the right foods that are really important. And of course, many of us, when we got sort of siloed off to home, found our schedules disrupted, our eating schedules, our sleeping schedules. Many of us had kids who we're now having to homeschool. And so working with patients and frankly with healthcare providers that I engage with around how to, as best as you can without beating yourself up for not being perfect, how can you enact these sorts of wellness practices that we know can keep especially things like depression and anxiety at bay. Now, conversely or additionally, I think it's really important that we recognize when a patient, when somebody that is doing these things, sometimes they're just not enough, and it's really important that we recognize when it's time, either in ourselves or our friends, in this case, to seek professional help, or with our patients who are already engaged with professional help when it's time to make a medicine adjustment or add something. Important to recognize when the person is beginning to slip and needs that sort of extra protection that pharmacologic agents can provide. And then, I'm often accused of being sort of Eeyore. I'm not a smiley optimist by nature, but I've noticed that there are some real potential opportunities within this pandemic, as bad as it is. And one of them is, telepsychiatry is beginning to mature very rapidly. It has to. And I have certainly been involved with and seen and heard about cases where the patients that really had a hard time, finding their way into their doctor's office or into the clinic, are actually making more connections now because they're able to do it by telepsychiatry. And in people whose resources or time were already strained, this has opened up a new window, actually not for less engagement with their providers, but for more engagement. And then I can give you an example from my own practice. So I said, these days I mostly serve as a consultant. As you know, I'm mostly a researcher, but I consult and train the residents at UW-Madison. And so, on a rotating basis, I see patients in the hospital that have done something that requires that they're on a medical unit, but they have psychiatric needs. And just recently, we had this really interesting case of a young lady with borderline personality disorder who made a suicide gesture. She had a boyfriend who wanted to break up with her, and she tried to control the situation by making a suicide gesture, and she messed up a little bit in the gesture. She cut her wrists the wrong direction. She ended up in the hospital, and I've run inpatient services off and on for years, and very often when somebody, especially with a borderline personality makeup, does something like this, they get a lot of attention. Sometimes it heals the relationship briefly. People come to see them, and that influences what that act means for them. Well, this young lady did this, landed in the hospital, and suddenly found out that she was completely isolated, and isolated for a number of days. And it was a really, really difficult situation for her. But interestingly, when she went back to her clinician, when she was discharged, she said, I have to admit, I learned something, that those sort of acting out behaviors come at a cost. And this time it came at an unexpected cost. And man, I don't want to do that again. So, interestingly, in the midst of these difficulties, here's an example of how, just like telepsychiatry may hold some promise for some folks, it's not all bad. Sometimes these sorts of stressors cause people to see things in new ways and important ways that can be valuable for their mental health.
I like that, Chuck, because I think sometimes in the conversations around this pandemic, we sort of fall into gloom and doom conversations. And I think what you've shared with all of us so eloquently is there are some positive opportunities to really learn different ways, some psychological flexibility for your patient, as an example. So thank you for that. I appreciate it. Chuck, it is quite clear that this pandemic has affected all of us at not only a professional level, but a personal level as well. I'm wondering for you, Chuck, what adjustments have you made professionally? You've talked about some of those, but also in your personal life.
Yeah, well, so, it's interesting. It's been sort of an evolving situation for me. When the pandemic first hit, there were a couple of weeks where everything sort of stopped. And that had a rather profound effect on me because it gave me a chance, the sudden stopping gave me a chance to really get a good look in the rearview mirror of the life I was living. And I realized that many of the things I was doing, I've been extremely busy and I fly around a lot. Many of the things I was doing were not the things that I would cherish on my deathbed. And it really gave me pause to think about what was most important in my life and to recognize, like all of us, that I can't always spend all my time doing the things that are most important to me. I have to make a living, but it was really quite an interesting moment. And then because much of my job is the sort of thing that can be done online, slowly over time, the busyness has crept back. So that now I find myself spending 5, 6, 7 hours a day online talking like we are now. And I must admit, I don't like it. And I miss very much the sort of personal being with somebody, being in this space, moving around a little bit. So one of the challenges I've had to face is that I've been, soldered onto my computer screen, and I find it very tiring. There have been some other real impacts. I'm mostly a researcher, and it's really fascinating. Research has all around the country closed down, at least human subject research, and is just now being evaluated to open again. And Sandra, as you know, I am the director of research for USONA Institute, which is working on the development of psilocybin as a new treatment for major depression. And the treatment involves patients sitting in a room for about 6, 7, 8 hours with 2 therapists or facilitators that are with them during the psilocybin session. And, if you're having a psychedelic experience, what they colloquially is called a trip, you probably don't want to be sitting with people, wearing moon suits. And so the challenge of how do we make it a safe experience has stopped our studies for months now. It's really interesting. So it's definitely affected, and of course that affects my personal life because I worry. Resident supervision has changed. I used to go see patients with the residents. Now the health risk does not, justify that. And so we're seeing patients virtually, which again is good and bad, but in this case, it's probably bad overall because, you lose something when you can't see a patient in person that you were, like in a hospital bed that I would have been able to see and provide more comfort to probably. So I've been doing a lot, as I said, more online stuff. We've been doing some interesting online stuff. So I serve as the director of research on spiritual health for Emory Healthcare in Atlanta, Georgia. And I have been recording very short videos that are sort of meant to be thought-provoking or inspirational for basically for the hospital chaplains and their YouTube channels. So a lot of online work. And then, as I said, in the beginning, it really has given me a time to reevaluate what I most value in life and to recognize, frankly, how precious human life is and how arrogant we were in a way before the pandemic that we all knew we were going to die someday, but I think most of us thought that, tomorrow was sort of a sure thing. And I've lost that feeling and it's nerve wracking, but it's not all bad. And then, I keep an eye on my own stress and anxiety levels, like a lot of psychiatrists. I've had my struggles with depression and anxiety. And so we talked a little while ago about trying to recognize when health promoting strategies, wellness strategies are not enough. I keep the same eye on myself to make sure that I'm within bounds in terms of my own psychological well-being.
I think what you just described, Chuck, both professional adaptations as well as from a personal perspective, is going to resonate very loudly with all of our Psych Congress family viewers. I can't thank you enough for joining me today, Chuck.
Oh, my pleasure, Sandra.
It's always an absolute treat spending time and talking with you. This is such an important conversation about the challenges that our patients with mental health problems are facing during this pandemic. And truthfully, those that we face as their providers. We hope that you found this conversation helpful both in your professional and your personal lives. Let me end by saying, we hope that you stay healthy and well. Goodbye for now.